morning everyone. Today's my topic of presentation is on a case series of glaucomatous optic atrophy. Glaucomatous optic atrophy can be characterized as an irreversible end-stage glaucomatous optic neuropathy with associated severe visual field loss and reduction of acuity. Clinically apparent is advanced optic disc optic cupping, loss of neuroretinal rim tissue, and optic pallor. This degree of optic neuropathy and functional visual loss can be secondary to various contributing factors, including an undiagnosed, poorly managed, or poorly controlled primary or secondary glaucoma. It is a retrospective study done in Department of Ophthalmology, Tertiary Care Center. Duration of study is 1 year. Sample sizes of 30 cases. Inclusion criteria: all known cases of glaucoma under treatment. Exclusion criteria is patient less than 40 years and optic atrophy due to other causes are excluded. Coming to patients, number of patients in 40 to 50 years are 3 patients, 50 to 60 are 16 patients, and above 60 are 11 patients. In total 30 cases, 16 were female and 14 were male. Visual acuity in affected eye, that is glaucomatous optic atrophy patient, it is ranged from no perception of light, hand movements and counting fingers at 1 and 2 meters. Other eye, that is normal eye, visual acuity ranged from 6/24 to 6/9. Out of 30 cases, 16 patients have angle closure glaucoma and 14 patients have open angle glaucoma. Out of 30 cases, 18 patients are taking regular medication in which progression of disease is ranged from 4 years to 15 years, and 12 patients are taking irregular medication. Progression of disease range from 3 years to 9 years. Out of 30 cases, 12 patients have family history, 18 patients doesn't have a family history, and 20 patients have bilateral glaucomatous optic atrophy, 10 patients have unilateral. Fundus changes seen are in advanced cupping, with that is 0.9 to total cupping with disc pallor is seen in all patients. Other signs like bionating sign, laminar dot sign are seen in only 20 patients, and peripapillary atrophy is seen in 25 patients, and neuroretinal rim loss is seen in all patients. These are the pictures I have collected showing both eyes glaucomatous optic atrophy. This is the patient having tunnel vision with visual acuity 6/9 in both eyes, showing visual fields, tunnel vision, and glaucomatous optic atrophy. Discussion: study of total 30 cases were examined, of which 16 were female and 14 were male. 12 patients are irregular medication and 18 patients are on regular medication, of which 12 having family history. In 30 cases, 20 patients having bilateral glaucomatous optic atrophy, 10 patients having unilateral glaucomatous optic atrophy. Predictive factors leading to progression found to be vary depending on the level of IOP during the course of disease. For patients with elevated intraocular pressure, significant predictive factors for eventual progression were older age, advanced perimetric damage, smaller neuroretinal rim, and larger area of beta zone of parapapillary atrophy. Coming to conclusion, the development of end-stage glaucomatous optic atrophy leading to permanent visual loss is a disease process which may be proceeding at many levels. Certain ocular, genetic, and systemic conditions are most probably intertwined depending on the individual. The goal of therapy is to prevent progression and subsequent irreversible loss of vision. Therefore, a multidisciplinary approach for prevention, control, and management of the at-risk is mandatory. The importance of aggressive ocular treatment, proper diagnosis, compliance must not be underestimated. These are my references. Thank you.
When you say the patient has glaucomatous optic atrophy, what is the vision that you are expecting?
Hand movements to some patients having perception of light, some patients having no perception of light also.
Generally, if it is an optic atrophy, it is no perception of light. And how did you do fields for such patient?
Only for tunnel vision I have done.
Okay, then don't include that in this.
That's why I didn't include.
Okay, thank you.
Thank you.
Can you go back to your, what are the optic nerve head changes we expect in the case of glaucoma? Go back to that slide. What are the changes you have documented? This one.
Advanced cupping.
Okay. Now, in all of them, it was more than 0.9.
Yes, sir.
Any retinal nerve fiber layer defect?
Retinal nerve fiber layer defect I can't.
You did not document?
Yes,
is it important?
Yes, sir.
Okay. Now, any absence or presence of splinter hemorrhages?
Splinter hemorrhages, mostly I didn't.
You did not see.
Yes.
Okay. Can you go up to the very first slide? Your definition of. See, you again mentioned glaucomatous optic atrophy can be characterized as irreversible end-stage glaucomatous optic atrophy.
Neuropathy.
Okay. It is more of a optic nerve head changes, advanced optic nerve head changes. Anyway, thank you so much.
Thank you.